today I'm going to talk a little bit about jowling after you get your masseters treated. There's a lot of talk on social media about that now, so I figured I would address it. Basically, when we treat the masseters, we use Botox to shrink the muscle mass. That will help people that have TMJ symptoms to do less clenching, which is better for their teeth. It will cause less headaches, less jaw pain. One of the side effects is that because you shrink the muscles, you'll also get facial slimming, which when you're younger is not a bad thing at all. However, when you're older, you actually need that volume to help hold up your lower face, because when this gets too small, all this support disappears and all this tissue starts sliding forward, which is what creates jowling. This happens naturally when you get older anyways. The bone on this side actually starts shrinking, so that's why people get jowls when they get older. When you do masseter Botox, you kind of artificially create that. So when people are older, you have to be very careful when you treat their masseters. If people have bad TMJ symptoms and it starts damaging their teeth and they have a lot of headaches, I would still do it, but you may want to consider doing things that help prevent your jowling from getting worse. One of the easiest thing would be to use filler to replace the volume that you lose, and putting filler on the gonial angle, that could be a good option. Another thing would be to do treatments that help tighten the lower face. I love Ellacor. It's a new treatment that uses microcoring to remove little pieces of skin. It's a great way to help tighten the lower face. You can also do things that strengthen the skin like Softwave or Ulthera. They will also help lift and tighten the lower face. And then last but not least, you can actually use Botox underneath the jowls and in the jowl area to reduce the pulling down effect that you get in this area that helps tug down on the jowls. So if you do need masseter Botox, consider doing the combination of these treatments to prevent jowling or prevent your jowling from getting worse.